Good evening. We're out here ready to go, ready to roll. All right. Good evening, friends, colleagues, and health enthusiasts across the globe. Dr. Joaquin Acosta, your guide on this transformative journey through the realms of pharmacy and healthcare. I'm the proud CEO of PharmTrue. Welcome to a special edition of tonight's Know Your Pharmacist live stream. As we step into an era where the intersection of technology, compassion, and health takes center stage, we're here to unravel, understand, and embrace the future of healthcare together. This evening is not just about information, it's about connection, understanding, and revolutionizing the way that we think about health and wellness. In our Pharmacist Frontline segment, we're diving deep into the heart of the pharmacy crisis. As we navigate through these challenges, remember it's in our unity and innovation that we find strength. Sponsored by PharmTrue, we are committed to leading the charge in creating health solutions that are not just effective, but also imbued with care and understanding. Our Tech Talk today will be a journey through the groundbreaking AI innovations in heart health. The fusion of human intellect and artificial intelligence by Eko Health is a testament to the extraordinary leaps we are making in healthcare. In our Enlightenment Hour segment, we shine a light on autism awareness. It's about embracing diversity and fostering an inclusive world where everyone has a place. Today, we stand together for understanding and acceptance. The Herbal Wellness Corner, sponsored by High Horse Cannabis Company, will explore the promising world of cannabis and PTSD treatment. Join us as we delve into the Harmony Method, a beacon of hope and holistic healing. Our community spotlight featuring the Baked Chicken Farm will take us to the serene Cruces Sound Bath. More than a sound therapy session, it's about community healing and the power of harmony. And finally, in our Men's Health Minute, sponsored by Vado Speedway Park, we'll unravel the mystery behind night sweats in men. Understanding our bodies is the first step to wellness. Tonight's live stream is more than just a show, it's a movement towards better health, deeper understanding, and a more connected world. So grab a seat and let's embark on this enlightening journey together. Welcome to Know Your Pharmacist. Let's make health not just a part of our lives, but a part of our soul. Jumping right on in. All right. Some interesting stuff here in our first segment, Pharmacist Frontline, coming out of the Pharmacy Times today. Share that with you here. Awesome. If you guys haven't checked out our PharmTrue Learning, you can absolutely access some awesome stuff when it comes to cannabis education, guys. That is something that we absolutely hit hard and bring to the community for sure. So I want to make sure we show that, and we'll make sure, as well to send everybody else, go on over to High Horse right up here. So we'll be flashing those two throughout the rest of my lives. For whatever reason, I don't think Facebook and Instagram Live, the opening credits have a shopping promotion for whatever reason. Anyways, shout out to all our show sponsors. Awesome stuff. Slowing down right here, seeing through the fog of Pharmageddon, as according to Pharmacy Times, there's some interesting stuff around this corner. If you guys hadn't, need a refresher on what is Pharmageddon, right? There was pharmacy walkouts in all the big box corporations, Walgreens, CVS, Rite Aid, starting about the first part of the fourth quarter of last year. And, pharmacists actually started walking out. They were organizing days to walk out and protest against the basically, inhumane working conditions that are being asked a lot of pharmacists to be working basically with no staff, with insane amount of objectives and metrics that are ultimately affecting patient care, health, and safety and well-being of our patients. And not only that, but pharmacists. There's already, I think, been 2 suicides in the pharmacy world since then. And, that's absolutely devastating. One where CVS didn't even really acknowledge the fact that the pharmacist felt so pressured that she had to stay on shift versus actually go home when she had elevated blood pressure because she was so guilty about it, right? So it's crazy. Anyways, coming out of here, pharmacists are uniquely positioned to play a frontline role in advancing health equity. This will require, however, that we build the pipeline of future pharmacists and preserve vital community touchpoints. Well, the healthcare industry is experiencing a severe shortage of pharmacists, and at the same time, pharmacists, like other health professionals, are grappling with burnout and challenging work conditions. This has become increasingly pronounced in community pharmacies, leading to reduction in operating hours, pharmacy closures, and high-profile walkouts at a large handful of retail pharmacy chains. What does this mean for patients and for the healthcare system as a whole? While the role of pharmacists, the critical role of pharmacists and pharmacies cannot be overstated. For many, pharmacies are the most accessible point of contact with the healthcare system. The loss of these vital hubs, particularly in rural and underserved communities, cough, cough, all over New Mexico, unless you're in the Albuquerque Metro, Santa Fe Metro, or even Las Cruces, is an emerging and existential risk to healthcare access. Fortunately, there are reasons for long-term optimism, even amid the so-called Pharmageddon. Drawing from experience as a community and hospital pharmacist, according to Sean Spencer, pharmacist and doctor who wrote the article, and now in higher education, I believe that challenges impacting pharmacies are emblematic of transformative forces that are reshaping all of healthcare. This includes not only consolidation and consumerization, but also digitization, automation, and a surge in employee activism. Ultimately, the pharmacy may be a harbinger for where the broader industry is headed. Pharmacies and professionals who run them are increasingly at the forefront of the day-to-day healthcare delivery. Patients visit pharmacies 12 times more often than their family doctors. High-risk patients visit their pharmacy an average of 35 times a year compared to only 4 primary care visits, if that. About 90% of Americans live within 5 miles of a pharmacy, and 61% expect that primary care services will be increasingly, even primarily, offered through their local pharmacy or pharmacy clinic, according to a recent survey. The COVID-19 pandemic further underscored the important role of pharmacists within the healthcare system. Data show that upward of 90% of COVID vaccines were provided through pharmacies, excluding certain temporary health public vaccination sites for which claims data is not available. Beyond COVID-19, pharmacies also handle 60 to 70% of flu vaccinations during the average annual cold and flu season. Today, pharmacists are administering routine vaccinations more than physicians. The integration of digital solutions and automations not only streamlines processes, but also opens up opportunities for pharmacists to continue engaging in this type of community-facing and vertically integrated healthcare. Perhaps the most important aspect of this changing paradigm is how payers, public officials, and health equity advocates are responding to shifts in pharmacy practice and consumer preference. Value-based care has surpassed fee-for-service as the dominant healthcare payment model in the United States, placing ever greater emphasis on health outcomes. Pharmacists play an important role in value-based care delivery, not only administering prescriptions, but also helping to counsel health plan members, manage healthcare costs, and ensure medication adherence among patients with chronic conditions. No surprise then that a sizable share of pharmacist job postings are in managed care, with national payers among the largest employers. Cough, vertically integrated and horizontally integrated, CVS, Walgreens, United Healthcare, Express Scripts, right? For the first time in several years, pharmacist compensation is rising as retail pharmacies compete with payers and hospitals for a limited pool of pharmacy talent. Public officials are also taking innovative steps to empower health pharmacists and address critical healthcare needs. Test and treat legislation would allow pharmacists to administer tests and prescribe appropriate treatments right in the pharmacy setting. New Mexico, we are pretty progressive on that one. Patients have widely embraced this flexibility, and in fact, pharmacists are as trusted as nurse practitioners and physician's assistants when it comes to diagnosing common conditions and issuing prescriptions. States that have embraced test and treat are leading the nation in expanding healthcare access and improving patient outcomes. As noted, pharmacist accessibility brings compelling health equity benefits, and studies have shown already that pharmacy closures disproportionately affect underserved neighborhoods, deepening existing health disparities, said Omolola Adeboju, PhD and MPH, in a press release, who led an important study on pharmacies and their relationship to medically underserved areas. So-called pharmacy deserts have profound consequences as patients in these areas struggle to manage chronic health conditions and maintain reliable access to medications. With advanced clinical knowledge and an accessible on-the-ground presence, pharmacists are uniquely positioned to play a frontline role in advancing health equity. This will require, however, that we build the pipeline of future pharmacists and preserve vital community touchpoints where pharmacists can nurture long-term patient relationships. Despite the shifting healthcare landscapes and the near-term challenges for pharmacies, certain fundamentals remain largely unchanged and optimistic. 97% of Americans want a pharmacist to educate them about their medication, and overwhelming majorities look to pharmacists as trusted members of their healthcare team. For now, we need to show extra patience at the pharmacy counter, but there is a light beyond the fog of Pharmageddon. Very optimistic article. Love the phrasing of it. Love how it goes. The reality is, there's still so many issues that need course correction. And, as much as we love these feel-good stories, we know those pharmacists that are working in those big box chains are absolutely still suffering. And we know patient care is still suffering alike, down the line of all that. When is it going to get fixed? Who knows, right? Pizza is not the answer. And we all know that from the pharmacy world. And again, an acknowledgement and clapping and cheering you on for cheering us on as pharmacists, for the roles that we may play or the roles that we can play with, when they're still not uniform, when they're still getting squeezed and nickel and dime, all kinds, and still affecting the general, health outcomes of our general public. It is a big deal that absolutely needs attention. And there's a lot of different issues and different fronts there to be able to battle on, right? Not only the PBM front, as we already saw, guys like Mark Cuban are there now trying to fight that good fight, which, respect the man there. And then, just the overall workers. And granted, there hasn't been much cases yet of forming unions, but, basically unionizing as pharmacists against the big box corporations. We know the big box corporations already have a lot of union protection rights within them, but again, the walkouts have been a big deal. Again, they've also lost a little bit of steam here in the first quarter of 2024, which we don't want that to get left behind or forgotten. No pharmacist left behind. How about that? Our Pharmacist Frontline segment sponsored by PharmTrue. We appreciate everything all our pharmacists do for all our communities, wherever you work and whatever you're having to deal with to, put patient care at the front when, it becomes you're working for places that put profit over people and profits over patients. That's absolute jokester, that's killing us. So anyways, let's move on to our Tech Talk segment. Some pretty interesting stuff coming out of the FDA clearance today. The FDA clearing first AI to aid heart failure detection during routine checkups. Interesting stuff, right? Anyways, Eko Health, a pioneer in applying artificial intelligence for early detection of heart and lung diseases, announces that FDA clearance for low ejection fraction detection, or EF-AI. For the first time, United States healthcare providers can now detect low EF, a key heart failure indicator, in 15 seconds using the Eko stethoscope during a routine physical examination. This late detection marks both a significant medical innovation and a new era of the detection of cardiovascular disease. In the United States, more than 6 million people battle heart failure. Half of them experiencing heart failure with reduced ejection fraction, condition marked by the heart's inability to blood effectively. Traditional heart failure detection tools such as echocardiography are often unavailable in primary care settings as they are costly, require specialized training, and add significant time. As a result, many heart failure cases go undiagnosed until symptoms force specialist or emergency hospital visit, leading to worse patient outcomes and exacerbated healthcare costs. Well, Eko's low ejection fraction AI disrupts this status quo by embedding rapid and accessible low ejection fraction detection into a stethoscope exam on the front lines of care. Well, the ability to identify potentially life-threatening heart conditions using that primary care subspecialist clinicians are familiar with stethoscopes help us prevent hospitalizations and adverse events, said Dr. Paul Friedman, chair of the Department of Cardiovascular Medicine at Mayo Clinic in Rochester. Importantly, since a stethoscope is small and portable, this technology can be used in urban and remote locations and hopefully help with care in underserved areas. The low ejection fraction AI will also be added to Eko Sensora cardiac early detection platform. Latest advancements in the platform, which already features FDA-cleared algorithms to identify AFib and structural heart murmurs, often indicator of valvular heart disease. When low ejection fraction is detected by a primary care exam with Sensora, access to life-extending treatment can be expedited with a referral to the cardiology department for thorough diagnostic testing and treatment evaluation. The stethoscope, the most recognized symbol of healthcare, touches lives of an estimated 1 billion people around the globe every year, said Connor Landgraf, co-founder and CEO of Eko Health. With AI, we've transformed the icon of medicine into an AI-powered heart failure early detection tool that can improve healthcare access to care for millions of patients at a fraction of the time and the cost of echocardiography. It's been a privilege to work alongside Mayo Clinic in the breaking endeavor. Well, the validation highlights, discussing this, talking trained on a proprietary data set of over 100,000 ECGs and echocardiogram pairs from unique patients, validated in a multi-site prospective clinical study of 3,456 patients, achieving an AUROC of 0.835 for detection of basically detection fraction less than 40%, 74.7% sensitivity and 77.5% specificity, demonstrating a strong ability to differentiate between low and normal ejection fraction. I know those are a lot of big words for those listening there, but I think getting a little demo of the Eko stethoscope, I'm showing you guys that, and to be cool thing to show here. So basically, let me show this right here. Bam, bam, bam. And so this is just a quick video tutorial. There's some pretty cool, podcasts about these AI-powered stethoscopes and so on and so forth. But anyways,